You are the nurse taking care of a patient with intractable back pain. You are about to administer a dose of oxycodone and are describing possible side effects to the patient. Which of the following common side effects should you warn the patient about? A. Constipation. B. Blindness. C. Headache. D. Tinnitus. E. Serotonin syndrome. The answer is A. Constipation. Constipation is a very common side effect associated with use of opioid medications, such as oxycodone, especially in patients who have not been frequently treated with opioids in the past. As such, patients are often advised ahead of time about the possibility this side effect and may be started concurrently on stool softeners and colonic motility agents, such as Senna and Docusate. Blindness, tinnitus, ringing in the ears, headache, and serotonin syndrome all are not known to be associated with use of opioid medications, like oxycodone. You are the nurse taking care of a patient with severe hip pain that is unresponsive to acetaminophen and NSAIDs. You are prepare a dose of hydromorphone and describe potential side effects to the patient. Which of the following side effects should you warn the patient about? A. Foot pain. B. Pruritus. C. Diarrhea. D. Pharyngitis. E. Hair loss. The answer is B. Pruritus. Pruritus, or itching, is a fairly common side effect of opioid medication use, and hydromorphone, also known as Dilaudid, is a potent opioid. As such, patients should be advised of this potential side effect prior to initiation of therapy, and should be advised to inform the nursing or medical care team if they experience pruritus, as dosing can be adjusted, and/or additional medications may be added to control the itchiness. Neither hair loss, foot pain, pharyngitis, nor diarrhea are side effects known to be associated with opioid use. The answer is E. Diarrhea. Diarrhea is a common side effect associated with antibiotic use, including cefalexin. This diarrhea is typically self-limited and resolves within the first day or two of administration. Sometimes patients are advised to take a probiotic or consume yogurt when starting a new antibiotic if they experienced diarrhea when starting antibiotics in the past. Neither headaches, hair loss, pharyngitis, nor necrotizing skin rash are known common side effects of cefalexin use. You are the nurse in a primary care clinic taking care of a 26-year-old female with a urinary tract infection. You are counseling her about taking her antibiotic, cefalexin. You warn her that a common side effect is which of the following? A. Pharyngitis. B. Headache. C. Hair loss. D. Necrotizing skin rash. E. Diarrhea. The answer is E. Pregnancy. Patients initiating isotretinoin therapy should all be strictly advised to avoid becoming pregnant, and must absolutely not be started on isotretinoin therapy if they are actively pregnant. Isotretinoin is a potent teratogenic agent, and could cause devastating effects to a developing fetus, including but not limited to termination of the pregnancy. Even one dose of isotretinoin can cause major birth defects of the baby's ears, eyes, face, skull, heart, and brain. Any female patient who is going to start isotretinoin therapy must be tested for pregnancy immediately prior to therapy and repeatedly throughout treatment. Make sure you use 2 specific forms of birth control and have regular pregnancy tests while taking this medication. There is no known significant interaction between isotretinoin and NSAID use. Likewise, there is no reason why a patient on isotretinoin must avoid bananas, grains, or juices. You are the nurse in a dermatology clinic taking care of a 22-year-old female with severe nodular acne. She is going to start isotretinoin therapy after this appointment. She should be strictly advised to avoid which of the following? A. Eating grain products. B. Taking NSAIDs. C. Drinking juices. D. Eating bananas. E. Pregnancy. The answer is D. Edema. All of these are possible side effects of calcium channel blockers, but the most common side effect is edema. Calcium channel blockers decrease blood pressure by hindering the influx of calcium into myocardial cells. They may also increase the diameter of blood vessels, which always results in decreased blood pressure. Which of the following is the most common adverse effect of calcium channel blockers? A. AV block. B. Gynecomastia. C. Nausea. D. Edema. The answer is D. Hypertension. Hydrochlorothiazide is a thiazide diuretic, used primarily in the treatment of hypertension and edema. Which of the following conditions can be treated with hydrochlorothiazide? A. Pericarditis. B. Angina. C. Atherosclerosis. D. Hypertension. The answer is B. Angiotensin receptor blocker, ARB. Losartan is an angiotensin receptor blocker, ARB. This class of drugs lowers blood pressure by blocking the conversion of angiotensin 1 to angiotensin 2 and is useful for patients who cannot tolerate ACE, angiotensin converting enzyme, inhibitors' adverse effects. What class of drug is losartan? A. Loop diuretic. B. Angiotensin receptor blocker, ARB. C. Angiotensin converting enzyme inhibitor, a CE inhibitor. D. Calcium channel blocker. The answer is D. Calcium channel blocker. Diltiazem is an example of a calcium channel blocker. This class of drugs reduces blood pressure by relaxing smooth muscles in the walls of arteries, leading to vasodilation and decreased peripheral resistance. Diltiazem is an example of what class of cardiovascular medication? A. Angiotensin receptor blocker. B. Beta blocker. C. Potassium-sparing diuretic. D. Calcium channel blocker. The answer is C. Block response to beta-adrenergic stimulation. Beta blockers act by blocking response to beta-adrenergic stimulation. In that way they are beta-adrenergic antagonists, rather than agonists. ACE, angiotensin-converting enzyme, inhibitors, not beta blockers, block the production of angiotensin II, but both act to decrease blood pressure. Beta blockers have nothing to do with beta cells of the pancreatic islets, which secrete insulin. Which of the following describes the mechanism of action of the class of drugs known as beta blockers? A. Beta-2 adrenergic agonists. B. Block the production of angiotensin II. C. Block response to beta-adrenergic stimulation. D. Block beta cell secretion in the pancreas. The answer is C. Beta blockers cannot be stopped abruptly due to risk of severe, even fatal, rebound hypertension. The most critical safety information a patient must know when initiating beta blocker therapy is that they cannot abruptly stop taking their beta blocker, due to the risk of rebound hypertension. A beta blocker would be more likely to cause bradycardia and a depressed effect than anxiety and tachycardia. Beta blockers are not associated with any type of esophagitis and they are not fat-soluble, thus it is not crucial to eat a fatty meal with the drug in order to improve absorption. When educating a patient on a new beta blocker prescription, which of the following safety information is most critical? A. Beta blockers should be eaten with a meal that contains fat to improve absorption. B. Beta blockers may cause anxiety and tachycardia. C. Beta blockers cannot be stopped abruptly due to risk of severe, even fatal, rebound hypertension. D. The patient must stay upright for at least 30 minutes after taking a beta blocker due to risk of esophagitis.